Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has issued a strike notice demanding the increment of salaries for doctors in the country. The Union Secretary General Davji Atela has decried what he terms as a meager salary paid to doctors despite the rising cost of living. The healthcare workers have also lamented discrimination and being sacked unceremoniously in some counties. Safin Achieng Ouma details this latest strike threat by healthcare workers.
Medical services in public hospitals across the country may soon be paralyzed after doctors in several counties announced that they will start their strike between the coming 7 and 14 days. Solidarity forever. Kenya Medical Practitioners, Pharmacists and Dentists Union Secretary General Davji Atela on Saturday said that among the grievances raised by doctors is the passing of the Finance Act of 2023, which will see them take a pay cut.
That Finance Act, our payroll, or rather our salaries, 52% of it will go to tax. And as such, the neck of the union has resolved to demand for a salary increase for doctors across the country.
Himji also decried the discrimination of doctors across several counties. For instance, at Kenyatta National Hospital, where doctors have threatened to strike in 2 weeks due to discrimination in payment of salaries and the sacking of their colleagues, allegedly without following due process. A crisis is also looming in Nakuru County, where over 500 healthcare workers were sent home and doctors are allegedly forced to take home meager salaries.
We find the government of Nakuru County to being rogue. We find Kenyatta hospitals being rogue, and they're out to actually frustrate and exploit healthcare workers and exploit doctors in this particular case. So we can't allow that.
From next week, doctors in Busia and Kakamega counties will be on a go-slow, decrying being mishandled and lack of promotions, with their counterparts in Machakos also planning demonstrations after they failed to reach an agreement with the county government. Doctors in Kiambu and Nandi are also contemplating a strike to push for better terms of pay, even as those in Garissa decry the unceremonious stoppage of their salaries. Himji says that the current average salary of a doctor, which is about 100,000 shillings, is not in tandem with the rising cost of living.
The last time that doctors had a change in their salary was in 2016. It's been 7 years. And today we can confidently say that more than 40% of our salary has reduced based on the cost of commodities in 2016 and today.
They want the national and county governments to urgently address their grievances to avert the looming crisis in the health sector.
We are demanding for collective bargaining agreements to be rapidly negotiated so that we can have salaries that are commensurate to the changes in the market price of commodities.
Solidarity forever. Their threat coming barely a week after the Union of Nurses and Clinical Officers also threatened that the workers will down their tools in 2 weeks as they demand, among others, an annual recruitment of about 20,000 health workers, better salaries and working environment. If the health workers make true their threat, this is likely to cripple the health sector, with thousands of patients needing critical care likely to be affected. Safin Achieng Ouma, Citizen TV.
Police in